Look at your fingernails right now. Press down firmly on one of them for about 2 seconds. Then let go and watch how quickly the color returns. It seems like a simple test, but what you just did may reveal more about your circulation than most people realize. The surprising truth is that your nails can sometimes provide early clues about changes happening inside your blood vessels, your circulation, and even your heart. Most people never pay much attention to their nails beyond trimming them or noticing when one breaks. But beneath every nail is a network of tiny blood vessels that can reflect changes occurring throughout the body. And after the age of 60, when cardiovascular problems often develop quietly and gradually, those subtle changes can become especially important. Many heart and circulation conditions don't begin with dramatic symptoms. Instead, they can progress silently for months or even years before they are discovered. Today, I'm going to show you 4 nail signs that researchers and healthcare professionals have linked to circulation problems, cardiovascular concerns, and increased stroke risk. One of these signs can be checked in less than 5 seconds using nothing but your own hand. Another is something millions of people see every day without realizing it could be important. And the 4th sign is the one I most want you to pay attention to because most people have never been taught to look for it. Before we begin, tell me your age in the comments and let me know if anyone in your family has ever experienced a heart attack or stroke. Your answer may make some of today's information even more relevant. And if you enjoy practical health information that helps you become more informed about your own body, don't forget to like the video. Now that you know why your nails can sometimes reflect changes in circulation, let's look at the first sign. Number 1 is bluish or purplish nail beds, a change known as cyanosis. At first glance, this may seem like a simple color change. Many older adults assume it happens because of colder weather, aging skin, or spending too much time in an air-conditioned room. While those factors can sometimes play a role, persistent changes in nail color deserve a closer look. To understand why, it helps to know a little about what is happening beneath the surface of your nails. Your nails are supplied by thousands of tiny blood vessels. These microscopic vessels constantly deliver oxygen and nutrients to the surrounding tissues. Because they are so small and close to the surface, changes in circulation can sometimes become visible here before they are noticed elsewhere in the body. That doesn't mean every nail color change signals a serious problem. However, it does mean that your nails can occasionally provide useful clues about how well blood and oxygen are reaching your extremities. So what exactly should you look for? The most noticeable sign is a bluish or purplish tint beneath the nail bed. In many cases, the color change is easiest to see near the base of the nail, where the tissue is thinner and blood vessels are more visible. Some people notice that several nails appear darker than usual. Others may observe a subtle blue tint that seems to come and go. In certain situations, the change may be more obvious after exposure to cold temperatures. What's important is not just the color itself, but whether the change persists or becomes more noticeable over time. When healthcare professionals discuss cyanosis, they generally divide it into 2 main categories. The first is called peripheral cyanosis. This type mainly affects the fingers, toes, hands, or feet. The nails may develop a bluish appearance, while other areas such as the lips and tongue remain their normal pink color. Peripheral cyanosis often develops gradually. Many people do not notice it right away because the change can be subtle at first. Sometimes it becomes more apparent during colder weather or after sitting still for extended periods. One reason this may occur is that blood flow to the extremities is reduced. As we age, circulation can naturally become less efficient. Certain cardiovascular conditions, vascular issues, or other health factors may also influence how effectively blood reaches the fingers and toes. Imagine an older adult sitting in a recliner for several hours. Over time, they begin noticing that their fingertips occasionally appear slightly bluish, especially when their hands feel cold. While there may be several possible explanations, the observation itself is worth paying attention to because it could reflect changes in circulation. The second type is called central cyanosis. This form is much more concerning because the discoloration is not limited to the fingers or toes. Instead, a bluish color may appear in the nails, lips, tongue, and even inside the mouth. Unlike peripheral cyanosis, which often reflects reduced circulation to the extremities, central cyanosis may indicate that the body is not receiving enough oxygen overall. This type of discoloration requires immediate medical attention. If someone develops sudden bluish coloring involving the lips, tongue, or mouth, particularly if it is accompanied by symptoms such as shortness of breath, chest discomfort, confusion, or dizziness, it should never be ignored. The key takeaway here is simple. Your nails can sometimes act as an early window into circulation and oxygen delivery throughout the body. A temporary color change after being out in the cold may not be unusual. However, persistent bluish or purplish discoloration, especially when it appears without an obvious explanation, deserves attention and may be worth discussing with a healthcare professional. The good news is that nail color is something you can monitor easily at home. Simply paying attention to changes over time can help you become more aware of what your body may be trying to tell you. And while color changes are often the first thing people notice, the next sign is different because it tends to develop so gradually that many people assume it's simply a normal part of getting older. Why it matters. A bluish or purplish tint beneath the nails is not something to ignore if it continues to appear over time. While temporary color changes can occur when your hands are cold or exposed to cooler temperatures, persistent discoloration may sometimes be associated with underlying circulation problems. The reason this matters is that your fingers and toes are located at the farthest reaches of the circulatory system. When blood flow becomes less efficient, these areas may show subtle changes before more obvious symptoms develop. In some cases, nail discoloration has been associated with conditions that affect how blood or oxygen moves throughout the body. For example, this type of change can sometimes be seen in individuals with heart failure, certain heart valve disorders, or chronic lung conditions that affect oxygen delivery. That does not mean everyone with bluish nails has one of these conditions. However, it does highlight why persistent changes deserve attention rather than being dismissed as a normal part of aging. Another important point is that many cardiovascular and respiratory conditions develop gradually. Symptoms may be mild at first, and some people adapt to those changes without realizing it. Because of this, seemingly small clues, such as a persistent change in nail color, can sometimes provide an early reason to seek medical advice and learn more about what may be contributing to the problem. Practical takeaway. One of the simplest things you can do is examine your nails periodically under natural daylight. Artificial lighting can sometimes make color changes difficult to judge accurately, while daylight provides a clearer view of the nail bed. If you notice a bluish or purplish tint, pay attention to whether it improves after your hands have warmed up. Temporary changes related to cold exposure often fade as circulation returns to normal. However, if the discoloration persists, repeatedly returns, or appears without an obvious explanation, it may be worth discussing with your healthcare provider. And remember, if blue discoloration is not limited to the nails and also affects the lips, tongue, or inside of the mouth, seek urgent medical attention. Changes involving these areas may indicate a more serious oxygenation problem that should be evaluated promptly. Before we move on, it's important to remember that not every circulation-related clue involves a change in color. In fact, the next sign often develops so gradually that many people simply assume it's a normal part of getting older. Number 2 is brittle or slow-growing nails. Many older adults notice changes in their nails over time. Perhaps a nail that was once strong now splits easily. Maybe the edges seem more fragile than they used to be. Some people find that their nails peel in thin layers, while others notice vertical cracks that seem to appear more often than before. Another common observation is that nail growth seems slower than it was a few years ago. Trimming nails becomes less frequent, and damaged nails may take much longer to grow out than expected. While aging can certainly influence nail health, persistent changes may sometimes reflect more than the passage of time. What to look for. Pay attention to nails that split easily during everyday activities. You may notice peeling layers near the tips or vertical cracks running from the edge toward the base of the nail. Some nails may feel thinner and more fragile than they once did. Slow growth is another change worth observing. Although nail growth naturally slows somewhat with age, a noticeable reduction in growth speed, especially when accompanied by other circulation-related symptoms, may deserve closer attention. These changes often develop gradually, which is one reason they can be easy to overlook. What's happening? To understand why this can occur, it helps to know how nails are formed. New nail tissue is produced in an area called the nail matrix, located beneath the skin at the base of the nail. This process requires a steady supply of oxygen, nutrients, and healthy blood flow. When circulation is functioning efficiently, the nail matrix receives the resources it needs to continuously produce strong, healthy nail tissue. However, if blood flow becomes less effective, the delivery of oxygen and nutrients may be reduced. Over time, this may affect how efficiently the nail matrix produces new nail cells. As a result, nails may become more fragile, grow more slowly, or develop structural changes such as splitting, cracking, or peeling. Again, brittle nails alone do not diagnose a circulation disorder. Many factors, including age, repeated exposure to water, nutritional deficiencies, and certain medications, can contribute to nail changes. However, circulation is one piece of the puzzle that should not be overlooked. Connection to peripheral artery disease, PAD. One circulation-related condition that deserves attention is peripheral artery disease, often called PAD. PAD occurs when arteries supplying blood to the arms and legs become narrowed over time. This narrowing is commonly caused by plaque buildup within the artery walls. Interestingly, this is the same general process involved in many heart attacks and strokes. While people often think about plaque affecting the heart or brain, similar changes can occur in arteries throughout the body. Because of this connection, healthcare professionals view PAD as more than just a circulation problem in the legs. It is often considered an important warning sign that a person's overall cardiovascular health may need closer evaluation. The challenge is that PAD can develop gradually over many years. Symptoms may start subtly and may not seem serious at first. Why it matters. This is where nail changes become especially interesting. Your nails require a continuous supply of blood to grow normally. When circulation becomes compromised, the effects may sometimes appear in these small tissues before a person recognizes broader circulation issues. Brittle or slow-growing nails do not automatically mean someone has PAD or another vascular condition. However, when these nail changes occur alongside other symptoms, they may provide another clue that blood flow is not as efficient as it should be. Early recognition matters because cardiovascular conditions often progress quietly. Many people live with reduced circulation for years before receiving a diagnosis. Paying attention to subtle physical changes may encourage earlier conversations with healthcare professionals and help identify issues before they become more serious. The pattern to watch. Rather than focusing on nail changes alone, it is often more useful to look for patterns. For example, an older adult may notice that their nails have become increasingly brittle over the past few years. At the same time, they frequently experience cold hands or cold feet, even when others around them feel comfortable. They may also notice heaviness, fatigue, aching, or cramping in their legs while walking. Perhaps a short walk that once felt easy now causes discomfort in the calves. One particularly important clue is whether these symptoms improve after resting. This pattern, discomfort during activity followed by relief during rest, is something healthcare professionals often pay attention to when evaluating circulation concerns. Of course, many different conditions can contribute to these symptoms, which is why proper medical evaluation is important. Practical takeaway. If you've noticed that your nails are becoming increasingly brittle, splitting more frequently, or growing much more slowly than they once did, consider viewing those changes as one piece of a larger picture rather than an isolated issue. Pay attention to whether other symptoms accompany the nail changes. Do your hands or feet frequently feel cold? Do your legs become tired, heavy, or uncomfortable when walking? Do those symptoms improve when you stop and rest? Keeping track of these observations can provide useful information to discuss with your healthcare provider. And while brittle nails may seem like a minor cosmetic concern, the next sign is different because it can be checked in just a few seconds and may offer another clue about how well blood is reaching the smallest vessels in your body. The first two signs require observation over time. The third sign is different because you can check it on yourself in less than 5 seconds, using nothing more than one of your fingernails. Number 3 is slow capillary refill. Many healthcare professionals use this simple test as a quick way to observe how efficiently blood is returning to the tiny vessels near the surface of the skin. While it is not a diagnostic test on its own, it can sometimes provide useful information about circulation. The reason this test is so interesting is that it focuses on the smallest blood vessels in the body, known as capillaries. These tiny vessels play a critical role in delivering oxygen and nutrients to tissues throughout the body. When circulation slows, changes may sometimes become noticeable here first. How to test it? The test is simple and only takes a few seconds. Start by choosing one of your fingernails. Using your thumb or finger, press firmly on the nail for about 2 seconds. You should see the nail turn pale or white as the blood is temporarily pushed out of the tiny vessels beneath it. Next, release the pressure and watch carefully. As blood flows back into the area, the normal pink color should return. This return of color is known as capillary refill. Because lighting can affect what you see, try performing the test in a well-lit room or near a window with natural daylight. Normal result. In most healthy adults, the pink color returns quickly. Typically, the color should return in less than 2 seconds. This indicates that blood is moving back into the capillaries efficiently. Keep in mind that minor variations can occur from person to person. The goal is not to measure the exact fraction of a second, but rather to notice whether the refill appears normal and consistent. Warning sign. A potential warning sign occurs when the pink color takes 3 seconds or longer to return on a repeated basis. One isolated result is usually not enough to draw conclusions. Factors such as room temperature, recent activity, hydration status, and even how the test is performed can influence the outcome. However, if the delay happens consistently and across multiple fingers, it may be worth paying attention to. The key word here is repeatedly. Healthcare professionals are generally more interested in patterns than in a single observation. Additional temperature check. There is another simple observation that can provide additional context. Compare the temperature of your hands to the temperature of your face. Your face typically receives a rich blood supply and often remains relatively warm. If your hands consistently feel noticeably cooler than your face, especially in comfortable indoor temperatures, it may suggest that circulation to the extremities is not as efficient as it could be. Again, this observation alone does not diagnose a problem. However, when combined with other signs, it can become part of a larger picture. What it may indicate. When capillary refill is consistently delayed, it may sometimes reflect slower microvascular circulation. In simple terms, this means blood may be moving less efficiently through the smallest vessels that supply tissues throughout the body. In some cases, delayed refill can be associated with reduced cardiac output, meaning the heart may not be pumping blood as effectively as it should. Healthcare professionals may also consider other cardiovascular factors when evaluating persistent circulation changes. Certain heart rhythm conditions, including atrial fibrillation, can affect blood flow dynamics and are important to identify because they may increase the risk of complications, such as stroke. Of course, many factors can influence circulation, which is why this simple test should never be viewed as a diagnosis. Instead, it serves as one small clue that may help guide a broader conversation about cardiovascular health. Why it matters. One reason slow capillary refill deserves attention is that it provides a glimpse into the body's microcirculation. Most people think about circulation in terms of major arteries and veins, but healthy blood flow depends just as much on the tiny vessels that deliver oxygen directly to tissues. When circulation becomes less efficient, these small vessels may sometimes reveal subtle changes before more obvious symptoms develop. That's why healthcare professionals often pay attention to capillary refill as part of a larger assessment. It is quick, non-invasive, and can offer additional information when combined with other observations such as cold extremities, fatigue, shortness of breath, or changes in exercise tolerance. For older adults, noticing these subtle clues may encourage earlier discussions with a healthcare provider and a better understanding of overall cardiovascular health. Important note: before becoming concerned about the results, remember that several harmless factors can affect capillary refill. Cold rooms can temporarily slow blood flow to the fingers. Certain medications may also influence circulation and alter the results. If your hands are cold, warm them first and repeat the test later. A single delayed result is usually much less meaningful than a consistent pattern observed over time. Practical takeaway. If you'd like to perform the test yourself, try it on at least 3 different fingers rather than relying on a single nail. Observe how quickly the color returns and whether the results are generally consistent. If refill repeatedly takes longer than 3 seconds, especially when your hands are warm and comfortable, consider making a note of it. You don't need to panic, and you don't need to diagnose yourself. Simply keep the information in mind and mention it during your next medical appointment. Your healthcare provider can evaluate the finding in the context of your overall health and any other symptoms you may be experiencing. Mid-video question. Before we move to the 4th and most overlooked sign, I'd love to hear from you. Have you tried the capillary refill test yet? If you have, let me know in the comments how many seconds it took for the color to return. And if you've never performed this simple check before today, tell us whether you were surprised by the result. Now we come to the sign that surprises almost everyone. In fact, many people have never heard the word associated with it before. Now we come to the sign that surprises almost everyone. In fact, many people have never heard the word associated with it before. Number 4 is changes in the lunula. If you've never heard that term, you're certainly not alone. Many people are familiar with the appearance of the lunula, but have no idea what it's called or why it exists. Yet this small area near the base of the nail may provide another clue worth paying attention to, especially when changes occur gradually over time. What is the lunula? The lunula is the small white half-moon shape that can often be seen near the base of the fingernail. Its name comes from the Latin word for little moon, which is fitting given its curved appearance. Although it may look like a separate part of the nail, the lunula actually represents the visible portion of the nail matrix. The nail matrix is the area beneath the skin where new nail tissue is formed. In other words, this small half-moon sits at the starting point of nail growth. Every time your nails grow, the process begins in this region. Because of its connection to nail formation, changes involving the lunula can sometimes attract the attention of healthcare professionals when evaluating overall nail health. What is considered normal? One reason the lunula can be confusing is that there is significant variation from person to person. For many healthy adults, the lunula is easiest to see on the thumbs. It is also commonly visible on the index fingers and often noticeable on the middle fingers. As you move toward the ring finger and pinky, the lunula may become smaller or disappear entirely. In fact, some people naturally have very small lunulas that are difficult to see, while others have larger and more obvious half-moon shapes. This is why it is usually more helpful to focus on changes rather than comparing your nails to someone else's. The question isn't whether your lunulas look exactly like a photograph in a textbook. The more useful question is whether they look different than they did before. Changes worth noticing. One change worth paying attention to is a lunula that becomes noticeably smaller over time. Another is the disappearance of a lunula from a finger where it was previously easy to see. Some people only notice this after comparing current photographs to older pictures of their hands. Color changes may also be worth observing. While minor variations can occur for many harmless reasons, significant or persistent changes in appearance deserve attention, particularly when they occur alongside other symptoms or nail changes. The goal is not to inspect your nails obsessively. Instead, it is simply to become familiar with what is normal for you so that meaningful changes are easier to recognize. Potential associations. Researchers have explored whether certain lunula changes may be associated with specific health conditions. For example, a reddish lunula has been linked in some studies to certain heart-related conditions. Researchers are still working to better understand these relationships, and a reddish lunula alone does not diagnose cardiovascular disease. A bluish lunula may sometimes raise questions about circulation or oxygenation. Because the nails are supplied by numerous small blood vessels, changes in color can occasionally reflect alterations in blood flow or oxygen delivery. Another change that has attracted attention is a very pale lunula. In some cases, pale coloration may be associated with anemia. Anemia occurs when the body has a reduced capacity to carry oxygen through the bloodstream. Over time, this can place additional demands on the heart and circulatory system as the body works harder to deliver oxygen where it is needed. It's important to remember that these are potential associations rather than direct diagnoses. Many factors can influence the appearance of the lunula, which is why any concerning change should be evaluated within the context of a person's overall health. Why this sign matters. This sign is particularly interesting because most people have never been taught to look at their lunulas in the first place. Many adults can identify changes in nail color or nail strength, but few routinely pay attention to the small half-moon shape near the base of the nail. As a result, changes can develop so gradually that they go unnoticed for years. That's what makes awareness valuable. You don't need specialized equipment, medical training, or complicated testing to observe your lunulas. Simply becoming familiar with their normal appearance gives you a baseline for comparison in the future. Like the other signs we've discussed today, lunula changes are not intended to diagnose disease. Instead, they represent another small clue that may help paint a broader picture of circulation, oxygen delivery, and overall health. When several subtle signs begin appearing together, they may provide useful information worth discussing with a healthcare professional. Practical takeaway. Take a moment every few weeks to examine your nails under natural light. Pay particular attention to your thumbs and index fingers, where the lunulas are often easiest to see. Notice whether the half-moon shapes appear similar to what you've observed in the past. Are they becoming smaller? Have they disappeared from fingers where they were previously visible? Has the color changed significantly? You don't need to monitor them daily, but occasional observation can help you recognize meaningful changes over time. If you notice unusual differences in visibility, size, or color that persist, consider mentioning them during your next healthcare appointment. While the change may turn out to be harmless, it is always reasonable to bring new or persistent physical changes to your provider's attention. Now that we've covered all 4 signs, the most important question becomes, what should you actually do with this information? What to do next? Now that we've covered all 4 signs, the most important question becomes, what should you actually do with this information? This is where many people make a mistake. They either ignore what they've noticed completely, or they immediately assume the worst. Neither approach is helpful. The goal is not to become worried about every small change in your nails. The goal is to become more aware of your body and recognize when certain patterns may deserve professional attention. My name is Dr. Maxwell Rowan, and while no single nail sign can diagnose a medical condition, these changes can provide useful clues that deserve attention. Your nails are only one small piece of the overall health picture. A change in nail color, growth, or appearance does not automatically mean something serious is happening. However, when changes persist, worsen over time, or appear alongside other symptoms, they may provide valuable information that shouldn't be ignored. The purpose of this video is not to help you diagnose yourself. Instead, it's to help you recognize when a conversation with your healthcare provider may be worthwhile. With that in mind, here are 5 simple steps you can take moving forward. Step 1. Examine your nails in natural daylight. The first step is surprisingly simple. Take a few moments to look closely at your nails under natural daylight. Sunlight often provides the clearest view of the nail bed and makes subtle color changes easier to see. Look for any bluish or purplish discoloration, unusual brittleness, slow nail growth, or changes in the lunulas near the base of the nails. You don't need to inspect your nails every day. A quick check every few weeks is usually enough to help you become familiar with what is normal for you. The more familiar you are with your baseline appearance, the easier it becomes to recognize meaningful changes. Step 2. Perform the capillary refill test. Next, try the capillary refill test we discussed earlier. Press firmly on a fingernail for about 2 seconds, release the pressure, and observe how quickly the pink color returns. Rather than testing only one finger, perform the test on multiple fingers to get a more complete picture. Remember that cold temperatures can affect the results, so make sure your hands are warm and comfortable before testing. If you notice delayed refill times on a repeated basis, simply make a note of it. The goal isn't to diagnose a condition. It's to gather useful information that can be discussed with a healthcare professional if needed. Step 3. Take clear photos of both hands. One of the most effective ways to monitor changes over time is also one of the simplest. Take clear photographs of both hands in good lighting. Many nail changes occur gradually. Because the process is slow, it can be difficult to remember exactly how your nails looked 6 months or even 1 year ago. Photographs create an objective record. If you notice a possible change later, you can compare current images with older ones, rather than relying entirely on memory. This can be particularly useful when tracking nail color, brittleness, growth patterns, or changes in the lunulas. Step 4. Write down what you've noticed. If something catches your attention, consider writing it down. Make a brief note about what you've observed and how long the change has been present. For example, you might note that your nails have become more brittle over the past 6 months, that your hands often feel unusually cold, or that a lunula appears smaller than it once did. Small details can be easy to forget, especially when months pass between medical appointments. Keeping a simple record can make future discussions with your healthcare provider much more productive and accurate. Step 5. Don't ignore multiple signs appearing together. Perhaps the most important step is looking at the bigger picture. Any single sign we've discussed today may have several possible explanations. Nail changes can occur for many reasons, including aging, environmental factors, medications, and other health conditions. However, when 2 or more signs appear together, they may deserve closer attention. For example, someone might notice brittle nails along with consistently cold feet. Another person may observe delayed capillary refill together with changes in nail color. Patterns like these are often more meaningful than any individual sign alone. If you notice multiple changes occurring at the same time, consider contacting your healthcare provider rather than waiting for your next annual visit. A simple conversation may help determine whether additional evaluation is appropriate and provide peace of mind if no significant concerns are found. The most important thing to remember is that awareness is not the same as worry. Paying attention to small changes gives you an opportunity to be proactive about your health and to seek guidance when something doesn't seem quite right. Important reminder. Before we finish, there's one final point that is worth emphasizing. Do not diagnose yourself based on any single nail sign. One of the biggest mistakes people make after learning about health indicators is assuming that one physical change automatically points to a specific condition. In reality, the human body is far more complex than that. A bluish nail bed, a brittle nail, a delayed capillary refill test, or a change in the lunula can each have multiple possible explanations. Some causes may be related to circulation, while others may be connected to aging, environmental factors, nutritional status, medications, temporary illnesses, or completely harmless variations. That's why healthcare professionals rarely rely on a single observation when evaluating someone's health. Instead, they look at the complete clinical picture. This includes symptoms, medical history, family history, lifestyle factors, medications, physical examination findings, and, when necessary, additional testing. For example, a nail change may mean something very different in a person who also experiences shortness of breath, chest discomfort, or leg pain than it would in someone who has no other symptoms at all. Context matters, patterns matter, and professional evaluation matters. The purpose of today's information is awareness, not self-diagnosis. By becoming familiar with these nail signs, you're not trying to diagnose a disease on your own. You're simply learning how to recognize changes that may deserve attention and discussion with a healthcare provider. That awareness can help you become a more informed and proactive participant in your healthcare decisions. Closing. Your body is constantly providing signals about what is happening beneath the surface. Some of those signals are obvious, others are much more subtle, and sometimes those subtle clues appear in places most people rarely think to check. Your nails may be one of those places. The tiny blood vessels beneath the nail bed, the speed at which your nails grow, the way color returns after pressure is applied, and even the appearance of the small half-moon shapes near the base of the nail can occasionally provide useful information about circulation and cardiovascular health. Of course, these signs are not diagnostic on their own, but they can serve as reminders to pay attention, ask questions, and seek professional guidance when something doesn't seem quite right. The goal isn't to become worried about every change you notice. The goal is to become more aware, because when you understand what your body may be trying to tell you, you're in a better position to make informed decisions about your health and well-being. Take a few moments this week to look at your nails in natural light. Notice what is normal for you. Keep track of any meaningful changes, and if something concerns you, don't hesitate to bring it up with your healthcare provider. Small observations today may lead to important conversations tomorrow. If you found this video helpful, subscribe to the channel and turn on notifications so you don't miss future videos focused on healthy aging, circulation, heart health, and practical wellness tips for adults over 60. And if you know someone who might benefit from learning about these 4 nail signs, consider sharing this video with them as well. Thank you for watching, and I'll see you in the next video.